So this is a case presentation done by me under the IPC, that is Infection Prevention and Control Capacity Building Eco Program, linked with the Eco India and Manipur Nursing Council, which was done. Here a case presentation was done regarding the COVID-19 pneumonia. So first, the patient identification data are given. Name I've written as a Mr. X, then age is 38 years, sex is male, then diagnosis of the patient is COVID-19 pneumonia. In the history of the present illness, the patient was apparently asymptomatic 10 days back. 10 days back he was well. Then suddenly he developed the onset of fever with chills, generalized body pain, for which he got admitted in another hospital and treated as a viral fever, and got discharged 2 days back. He developed chills with fevers, then generalized body pain, so he got admitted in the previous hospital. Then after treatment as a viral fever, he got discharged 2 days back. Then after the 2 days, now the patient developed the shortness of breath, cough with sputum, generalized weakness, burning sensation in the abdomen, and there was no history of vomiting, loose stool, and headache, chest pain, or palpitations. There was and mainly he developed the shortness of breath, cough with sputum, then generalized weakness and burning sensation in the abdomen. So these are the main symptoms that he showed. In the past history, patient has no other significant history of illness like diabetes mellitus, hypertension, tuberculosis, epilepsy, CBA, coronary artery diseases, thyroid disorders in the past. And he also has no history of any surgery or blood transfusion or IV drug use. Then no comorbidity was also there. So in the vitals, it is found that BP was 130 by 90 mm of mercury, temperature was 99.2 degree Fahrenheit, then pulse rate was 85 per minute, and respiration rate was 22 per minute. In the anthropometric measurements, height was 162 centimeter and weight is 73 kg. So BMI is 27.8 kg per meter square. In the physical examinations, in the skin there is no pallor, no rashes, no pustule, lesion, or discoloration. And under the respiratory system, no chest or neck retraction was there, as shortness of breath is present. Then decreased breath sounds in the basal lobe was there, and cough with sputum was present. In the CVS cerebrovascular system, S1 and S2 heart sounds are heard, and there is no cyanosis. In the GI system, there is no vomiting, no diarrhea, but abdominal pain was present, but there was no abdominal mass or hernia. In the investigations, hemoglobin was found to be 15.7, that is a normal range. Then PEG cell volume was found to be 46, that is also the normal. Then neutrophils, it was slightly higher than the normal, that is 83%. Then lymphocyte, also there is a lymphopenia, that is low lymphocyte count was low, that is a 13% was there. Then the dimer test, here also it is found to be high, that is 605. Then rapid antibody for COVID-19 was also done, which was found to be positive. And under the treatment given, injection remdesivir was given 200 mg stat IV, which is an antiviral. Then injection of augmentin is given, that is a amoxicillin plus clavulinate. This dose is 1.25 gram 3 times a day IV, which is an antibiotic. Then injection decardone is given, that is a dexamethasone. Dose is 6 mg once daily. in the IV route, and it is a corticosteroid. Then injection pump is also given. This is a pantoprazole 40 mg once daily in the IV route. This is a proton pump inhibitor. Then injection Clexane is also given, which is a enoxaparin 10 mg once daily in the subcutaneous route. That is the anticoagulant. Then injection optineuron is also given. In the optineuron, vitamin B6, B12, B2, vitamin D, and panthenol is there. 1 ampule is given once daily in the IV route. This is a vitamin. Then tablet ginkgobid, which is a multivitamin, is also given once daily per orally. Then tablet limc, that is the vitamin C, is also given once daily per orally. Then tablet riswas, which is a chloramphenicramine. Then 15 ml is given thrice daily per oral. It is an antihistamine plus antitussive medications. So these are the medications which are received by the patient. Then next is the problem statement. In the problem statement, the challenges faced. In the challenges faced, we have in treating the patient, there was no problem while doing the treatment of the patient, and while following the standard or transmission-based precaution due to the lack of necessary equipment and facilities and workforce, complete isolation of the patient was not done, and difficulty were faced with the use of PPEs, causing a lot of suffocation while working. And in improving the adherence to the IPC practices, if there were more manpower, then by doing the change of shifts, adherence to the IPC practices can be done more effectively. In the nursing management, under the infection prevention and control practice, the steps which are incorporated to decrease the risk of spreading the infection are performing the hand hygiene according to WHO, then clean hands with alcohol-based hand rub containing between 60 to 80% alcohol, or with soap, water, and disposable towels. Then staff training on putting on and removing PPE, and prompt access to the sufficient supplies. Do not reuse the PPEs. Not doing the reuse of the PPEs. Then supervision and regular monitoring and feedback by the IPC personnel. So these are the infection prevention and control practices that should be incorporated. And under the nursing management, health education and counseling are done at the time of the discharge, which are advising the patient to eat the balanced and nutritious diet and stay hydrated. Then advising the patient to avoid smoking and consumption of alcohol. Advising the patient to do the self-monitoring of temperature, SpO2 level at home with the help of the pulse oximeter. Then advising the patient to do breathing exercise using the incentive spirometry. Then advising the patient to take regular medications as advised. Then advise the patient to do the home isolation to avoid the spread of the disease. Advise the patient to inform the doctor if there is any fever, shortness of breath, dizziness, or when the SpO2 level is less than 90%.